Admitting all of our media. And as we wait for folks to join, waiting on one last reporter, and everybody is in. All right, welcome everybody. We really appreciate it. We do want to make sure that we are committed to being transparent, aware, we are open, and we are here for you, for your questions, for your feedback, and really to give an update on where we are and where we're headed. So I'd like to kick it off today with Dr. Ajay Kumar, our Chief Clinical Officer. So Dr. Kumar, take it away.
Thank you, Rebecca. Thank you, everybody, for joining. And I'm surrounded by some excellent colleagues of mine, Keith Grant and Ulysses, who are going to share some extra light on COVID pandemic right now. But let's start with Hartford HealthCare numbers. We are managing 61 patients as of this morning. Hartford Hospital has 26 patients. Midstate Medical Center has 13 patients. And the other hospitals have anywhere from 2 to 4 or 2 to 8 patients. Bacchus has 4 patients. Charlotte Hungerford has 2 patients. Our St. Vincent Medical Center has 9 patients. Hospital Center Connecticut has 5 patients. And Wyndham Hospital has 2 patients. And the sad part is that we're managing so many patients right now because largely our community remains, there's some segment of the community is still unvaccinated. And we are seeing those unvaccinated individuals coming to the hospital. I understand there is a vaccine hesitancy, and I understand about the concerns people have EUA versus FDA, and I acknowledge that part. In fact, over the weekend on Friday, I wrote an op-ed which was published in Hartford Courant talking about the FDA needs to get to a place of approving vaccines soon as possible. So I'm very hopeful that we will get there on that front as well. But because the vaccine hesitancy continues to be a significant issue and concerns about the information about the vaccine is all over the place to a certain extent. I am concerned that some of our community members are seeking information from sources which are not credible, which are based on myths or confusing arguments. Hartford HealthCare takes it very seriously. We are here for the community, and as of today, I'm really proud that we are announcing a call center, where individuals can call and talk about the vaccines, efficacy, the scientific evidence on that part, and our experts, our clinical leaders will be sitting and taking the call. The phone number of that hotline is 860-972-8100. And this went on live this morning. So far, we've already received 50 phone calls on that, asking about the vaccines and testing and other strategies. So once again, Hartford HealthCare is here to provide the information. We want to make sure that our community members are getting information from the right, credible sources about the vaccines and making appropriate decisions based on that.
Dr. Kumar, we wanted to tell our listeners, viewers, our media today that we are relaunching what you knew a year and a half ago as the state's first COVID hotline. That has been relaunched.
That's right.
So I think that is very valuable, and I appreciate that you shared the number. We would like to open this up to our media. We know you have lots and lots of questions from our experts. Anybody want to weigh in from Ulysses Wu or Keith Grant before we open it to questions?
I'd like to echo that Dr. Kumar's sentiments. I agree with everything he's saying. Unfortunately, disinformation seems to be one of the things that we are battling and that we are facing. And I share his concerns as well. But the truth in the reality is that this remains a pandemic of the unvaccinated at this point. And we are seeing some spillover into the vaccinated population. But with regards to critical illness, it remains an unvaccinated issue at this point. And the one plea I would put out there, if you all remember the old commercial, the dentist, the Colgate commercial, right? 9 out of 10 dentists recommend Colgate. Y'all have wondered who that 10th dentist was. And so you got to be careful in terms of who we're getting our information from. And I'm not saying be sheep and follow the masses, but when it comes to science, there's facts behind it. And you kind of want to rely on reliable sources. So I'll stop there and turn it over to Keith Grant.
Not much more I can add to you two gentlemen. I think I agree with everything that was said.
Thank you, Keith. Thank you, Ulysses. I would like to open it to questions.
I think Tracy has a question on the chat box, and I think she's asking, where are those not so credible sources of information? And Tracy, I can tell you what the credible sources of information are. That is the clinical leaders, the physicians, CDC, and there are other sources such as Facebook and a few other areas where individuals are presenting their opinions rather than scientific fact. I would consider them not so credible.
Great, Dr. Kumar. We can have folks raise hands, write in the text box. I know you have questions. Yes, Tracy O'Shaughnessy. Tracy, you can go first. I see your hand. You're going to have to go off of mute.
Can you hear me now?
Yep.
Okay, I beg your pardon. I submitted some early questions to Eleanor, but one of my first is, we continue to hear that this is what doctors are saying is they're saying the phrase younger, quicker, sicker. In other words, that that COVID is affecting younger people who get sick faster and who get sicker. Does that comport with what you are seeing there at Hartford Hospital or Hartford HealthCare? Excuse me.
I can take an answer on this, and I'd love to hear what others have to say. I think younger is correct, and that is the population that remains mostly unvaccinated. I'm not going to say quicker and sicker because it's a little bit of a hyperbolic statement. Now, are they getting quicker or are they getting quicker? Are they getting more ill earlier in the illness? Yeah, that's a possibility. But I think the presentation in the unvaccinated is actually still almost quite the same at this point. That's in the unvaccinated. In the vaccinated, they're actually coming in with milder illnesses, almost like allergies, almost like colds at this point. Some of these we're picking up, they're coming in for a completely different reason. And they said, oh, I've had the sniffles, and their COVID test ends up positive. So I'm going to say younger, not necessarily quicker and sicker, though. We are certainly seeing a sick population, and I don't want to minimize the severity of some of these illnesses, but I don't want to also overstate it.
Doctor, can I follow up with that, Dr. Wu? You had mentioned before, I believe, that one of the things that you do at Hartford HealthCare is test all the patients who come in for whatever reason. So what I'm wondering is, these patients who are vaccinated and are coming in with the sniffles, with what seem like allergies, if they are coming to the hospital, to the ED because, holy cow, what's happening to me? Or are they people who are coming in for some other procedure that you offer?
So for the vaccinated, it's a little bit of both. Some people are still coming in knowing that they're sick and they're wondering if they do have COVID, or they've been diagnosed with COVID and their symptoms seem to be getting worse. There is a small percentage, and I will say a small minority, of people that are in the hospital for completely different reasons, and we are just picking it up.
Excellent. I would like to go to Alex Putterman next. You have a few questions.
Yeah, hi everybody. First of all, on the hotline, when was the hotline originally paused, and why is it now coming back?
Alex, when was it paused? Ooh, I have to remind myself. I think it was, I have to get back to you to be precise. Actually, it's been days are getting mixed up right now. I think after second wave sometime, but I'll get back to you on that, Alex.
Just like this past spring.
Yeah.
I can pull that because we actually did it in stages, and we should have had that. But we'll absolutely get back to you on that. But the second part, the relaunch, was this morning.
Yep.
Yeah. So speaking of kind of relaunching things, it looks like statewide COVID testing has begun to increase somewhat in the last few weeks, a little higher than it was when the numbers were lower. Do you guys have adequate testing capacity, or what kind of strain, if any, is there on testing facilities right now?
Keith, you want to take this on?
Yeah, absolutely. So where testing is concerned, we're managing very, very well at this point. There is truly an increase, not just throughout the state of Connecticut, but across the country. And obviously, individuals are now seeing more individuals around them becoming positive for COVID-19. So a lot of people are testing because of, pure curiosity. Some people are testing might be out of fear itself. But as it stands right now, Hartford HealthCare is providing, it seemed to be sufficient infrastructure in order to facilitate testing. If we do continue to increase, we've had the conversation. So this team has had the conversation to include more people, have had the conversation about, how do we expand? And we do obviously have the ability and the knowledge and know-how how to expand our capacity and our capability for testing. But at this point in time, we're in a good position to manage what we're seeing as an increase.
I have another question from Brian Hallenbeck. Are we seeing a greater percentage of breakthrough cases? Should we expect that continue to be the trend going forward?
I guess I can answer that. So across the country, I think it still remains about 90% that are still unvaccinated. It depends what facility on what given day we have within our hospital. So it can be anywhere within HHC, anywhere from 70 to 90%. I don't think the percentage is going to change. I think the numbers will rise, but I think the percentage will remain the same, if that makes sense.
Anyone else want to weigh in on that? Have you seen, Dr. Kumar?
I think it's good. I think Ulysses covered it very well.
Yeah. So I think one of the things, so we talk a lot about breakthrough cases, and we've talked as a team as how do we talk about this actual data itself. So breakthrough cases is one. And remember when the vaccination came out and when we talked about efficacy, one of the things that is most important with the efficacy of this is that what's the state of the individuals that we're seeing that are considered breakthrough cases? Like how many of these patients needing critical care and need advanced care and management? And as we're seeing, the percentage remains 95 to 99% of the individuals needing critical care, needing ventilation, are individuals that has not been vaccinated.
Keith, can you say that one more time? Because I'm getting a lot of questions in this chat box asking for that again. Can you say that one more time? Sorry to stop you, but I'm seeing people aren't hearing that.
Yeah, absolutely. So there's a conversation about breakthrough cases, and breakthrough cases will happen. This is even based on the efficacy study for the vaccine. The true breakthrough cases, defined as a positive COVID-19 test after you've been fully vaccinated, that will happen. And we've proven that even through the trials itself. One of the questions and, our belief in the vaccine stems from appreciating that majority of individuals who are vaccinated go through the process of being identified as a breakthrough case will not experience the need for high level of care to include critical care. This is consistent with our current data itself at Hartford HealthCare, and it's considered consistent with the national data. Some studies or some data is looking at between 95 to 99% of individuals, so which means only about 1% of individuals that are in the critical care unit are indeed fully vaccinated. I think that's what the focus needs to be on, not the breakthrough cases, which based on all trials with the vaccines are very, very possible.
Critical point. Yep. Dr. Kumar, did you want to say something on that?
I think Keith has covered it very well. Thank you.
Okay. Another question. Have you seen an uptick in vaccinations given the concern over the Delta variant? And we have.
Exactly. Yeah, we are seeing increasing demand, rising demand. But the demand needs to be a lot higher than that. I think we still, the reason we're having conversation, the reason we are starting the hotline right now is to engage more community members to be able to ask questions and hopefully address their concerns about the vaccination to drive the vaccination rate even higher.
This is an interesting question from Alex. Is everyone who gets tested asked about their vaccination status?
So yes. So
go ahead, Keith.
So yeah, so we have there's multiple ways for us to verify vaccination status. To include a conversation with patients as well, but there's multiple ways now to confirm vaccination status. Very good question. The other question that we're asking as well is whether or not individuals have had COVID in the past, COVID-19 in the past. And we're getting some very interesting, I guess you could say, preliminary but data points on that as well.
And just to clarify, I think a lot of this, definitely, Keith is absolutely right. On the inpatient side, we are asking those questions. We can't really guarantee that this is happening at every satellite facility or every walk-in that's happening at CVS or whatever it may be.
Good and important. Another question asking about your own personal observations. Are you seeing the public taking the strong recommendation to mask up?
Rebecca, I missed your question. Do you mind coming again?
Sure. There is a question asking about your personal observations when you are out and about. Are you seeing people with their masks?
I haven't been out and about very much lately. So, generally, I have always been complimentary of Connecticut. I think Connecticut residents and citizens generally follow what the right science is. And at least a little understanding I have right now, I think the people are being careful. Delta variant is actually creating some anxiety among people, and people are asking questions. So I'm hoping that folks will take care of wearing the mask appropriately. I haven't been to the restaurants or any other place to comment on that lately. Maybe Keith, who goes out a lot more than I do, may comment on that.
And my boss keeps me very well entertained, so I am not able to go out a lot. But no, I do. One of the things that we have seen, like we've seen an increase in testing, we've seen an increase in vaccination, we've seen an increase in I hate to say anxiety and curiosity, but we've seen people being more cautious, more careful. So I do expect to see more people using their masks. So I think it all correlates very, very well generally. So I expect to see it.
Dr. Wu?
Obviously within our healthcare system, we are still having a universal mask. Well, I shouldn't say that, masking, especially in the clinical settings, absolutely. But Dr. Kumar stole my thunder. I don't go out, so I couldn't tell you what's happening in the restaurants. I have noticed anecdotally, grocery stores, Costco, BJ's, Target, all of those things. I see a lot of people turning around, going back to the car and saying, gosh darn it, I forgot my mask. And so I think that is definitely happening a little bit more at this point.
And you, all three of you have said over and over that we know what to do. We know what works. We know what to do. And that leads to this next question, that what do you recommend for COVID protection? And it's worth a reminder, what do we do?
Keith? Oh, Ulysses?
Well, one of the most basic concepts, wash your hands. Like proper hand hygiene is very, very important, not just for COVID-19. We're still within the respiratory viral season. There's a lot of things going on. And keep in mind, a healthier body does better with not just this virus, but any other virus. So protect yourself in that account. Regarding masking, there's very clear guidelines as to where it's needed. But also do your own risk assessment. If you think you're going to be within a situation that is probably more risky, higher risk, definitely wear your mask. If you're symptomatic at any point in time, or if you've been exposed, get tested. And within that time period, please stay away, especially from vulnerable population. Maintain social distancing and communicate as you gain this knowledge, communicate with your neighbors as well.
I agree with all that. I want you all to think of the protection as layers. It's not just one or the other. Each builds upon each other, and everything that Keith said is absolutely correct. You have vaccination, you have masking, you have social distancing, and you have hand hygiene. And I love the fifth layer is don't put yourself in a risky situation. Social behavior drives much of these infections. The unfortunate thing that happened out of the Cape Cod and the Provincetown news with a lot of people who were vaccinated who became infected was they neglected to say that they were engaged in more social behaviors at that point, more social than we would be doing in the course of our daily lives. And unfortunately, those social situations, I mean, I'm boring, so I wish I had some of those social situations, but those social situations will put you at a higher risk. And so that fifth untold risk factor, I think, is another layer that everybody needs to consider.
Dr. Kumar, someone has reached out asking about FDA approval, and you wrote an op-ed about this, addressing this, saying you believe it's time. We're hearing lots of rumblings. Any thoughts about when that happens? And we're assuming it's sooner than it has been. When that happens, will that affect vaccination rates?
Well, I think I want to start with recognizing the FDA has a very difficult task ahead of them, and they've always had that. And I've been very impressed how tremendous amount of diligence FDA has shown from the beginning of the pandemic crisis. They have a ton of data to review. They have a lot of studies coming out, and vaccines approval generally takes a lot more than short 2 years we've had this, or less than 2 years we've had this pandemic. And at least the news or information we've received so far is that they're actively looking into approving one of the vaccines in near future. And I think they have a tremendous amount of work ahead of them, but I'm glad FDA is looking into that. This modality of treatment as vaccine has been the most scrutinized in the history of mankind of any therapeutic agent, with more than 450 million vaccines given in the United States and billions across the world, which has been scrutinized from politicians and society and scientists and every single community member right now. This actually has probably passed all the tests at this time. And I think FDA will soon hopefully approve that. But irrespective of that, it should not be considered as an emergency or experimental medication at the moment, or vaccine at the moment. It should be considered as life-saving for us. We've seen the vaccines modify the disease course. We've seen the vaccines reduce the chances of mortality. I think this is a time for all of us to embrace the vaccines, and I'm hopefully FDA will approve it soon as well. Rebecca, I'm looking at some of the chat box here, and there are several questions which comes about, which has a similar tone. If I could address that, if that's okay with you.
Absolutely.
I think one of the questions I believe Sierra asked earlier on was that, do you foresee another shutdown? The second question is that what the trajectory may look like. And Tracy had asked the questions about, are the gyms and other areas safe right now? And if I could talk about from the Connecticut perspective, the way at least our clinical team sees that is that Connecticut is still doing well with 70% vaccination. We can do a lot better. We can do a lot better to reduce the mortality. Every single life is precious for a healthcare system like ours, and we want to protect everybody. With that said, if we have a large amount of people who are vaccinated and the Delta variant, which is highly contagious, comes along, it's going to find people who are ready for disease. These are unvaccinated people. And that's a large amount of people, 30% of the people we will find. So this pandemic will continue to be with us for some time, not at the highest level of what we saw in the first or second surge. Hopefully not, given so many people are already protected, but it'll continue to be present in our community. And I'm hoping with the appropriate diligence we show with the mask and other things we are talking about today, we don't come for another shutdown. I hope we don't have another shutdown on that in our Connecticut, on our state. At the same time, we do all have to take precautions and gyms where the large amount of people who are, if they are vaccinated and if they are managing social distancing, I would be okay with that. But the problem is we don't know actually who's vaccinated and who's not, who's carrying the disease and who's not. And those are the precautionary measures I would advise rather than going straight to the mask on that at this time. But if you are immunocompromised, if you have underlying disease, and even if you're vaccinated, I would advise you to wear the mask at that time, because you don't know who you're going to be in touch with, who may not be vaccinated or may have some disease they may be carrying at the time here. So this is where the personal responsibility comes into the play. And I think Connecticut has done a very good job in displaying that part here. And I'm hoping our citizens will do the right thing to avoid any further lockdown at this time.
That was valuable. Thank you, Dr. Kumar. This has come up as well as I look through some of the questions. And please, Keith and Ulysses, if you want to weigh in on what Dr. Kumar just said. Not right now. And we don't want to get too political, but people are asking, as folks are heading into school, and a lot of schools have made the decision that their kids will be masked, asking you to weigh in on that. Again, indoors, I think some of that you've covered, but I think it's worth repeating.
Sure. With regards or Keith, you want to go ahead?
No, please go.
Just, I mean, with regards to that, and we talked about the layers. There is a sixth layer that we should probably also discuss, which is common sense at this point. I mean, if common sense kicks in, masking in the absence of any other layers of protection is going to be important. And just going back to the science, we believe, I shouldn't say we believe, it is fact that indoor transmission, the pressures of indoor transmission is much greater than outdoor transmission. And so once you put yourself in that indoors environment, you are therefore increasing your risk for transmission, especially the more people that are indoors with you and the longer that you are with them. And so indoor transmission, I try to keep it simple. Keep it masked. Outdoors, you're probably okay unless you're in a large group setting, concerts, gatherings, festivals, things like that.
Any other questions for the team? I'll say that number again. That is 860-972-8100. That is that hotline. Viewers, listeners, readers, everyone can call into that number just like before, answer some of those questions.
This is specifically designed to talk about the vaccines, the scientific evidence or the hesitancy around that. This is to provide information to our community members. If they are on the sideline, they're thinking about the safety of the vaccine, they can get to our clinical providers and have a discussion around that. Very good.
Excellent. All right, 1:30 on the nose. Please, reach out to us if you have any questions. We are here to answer them. 860-972-8100. Thank you so much.
Yes, bye.
Thank you, everybody.